How can the collection of data and analysis of behavioral data assist in maintaining a positive classroom environment for all students? The information collected and analysis of behavioral data can assist teachers with an objective look into student behavior. It can help make informed decisions about classroom management according to the data collected. Tracking behaviors over time can help decipher what triggers a child, such as transitions or interactions with certain peers. Collecting this information will allow for strategies to stop issues before they occur or before they get worse. Data can help the teacher know when interventions are needed to assist children. They can receive support that is tailored strictly to them, which increases their chances of success. Tracking positive behaviors that are successful in the classroom may help other staff members when they must work with that particular student. It encourages more of the behavior that you want to see from the child, and it promotes a supportive atmosphere. Data collection can monitor the effectiveness that intervention strategies have on the children. Benefits of different methods of documenting and organizing observed behavioral data are that you can achieve tracking different types of data that all apply to the students in the class. Using checklists can be helpful in informal assessments throughout the day. The teacher can use a clipboard and keep the checklist there to let him or her know what they need to watch for. This type of documenting is easy to access and easy to check off. Data collection that involves timing of behaviors can be helpful to see what pattern might be triggering the student. If the student always struggles during transition time, then you will have the data to support that. This can reveal trends in behavior that will help the teacher or specialist best assist the child. Journaling on the students that may struggle can help determine that they may need further assessments. Keeping documentation for a certain period will allow you to present it to the administration to ask if they can get further testing. Some factors that may influence or hinder accurate behavioral data are if the data collection methods are inconsistent. There are times of the day when the child may act differently than other times. If the child is being observed at a certain time, they may not get accurate data collection. This is why documentation is necessary, because often it will show when the behavior is taking place. Technological issues can cause a hindrance on the data as well. Training in these programs that require technological input will be helpful, as there are always new programs coming out. Collaborating with families by collecting data about a student's home life is crucial for gaining an understanding of the whole child. Family and home environment can give you a better understanding of behaviors that are taking place that may make it easier to understand them. With this information, we can create consistency between home and school. If there are going to be interventions in place for a child, we want to make sure there will be follow-up at home as well. For example, if the child receives a sticker on their chart at school for positive behavior, then there should be the same reward system at home. When creating common behavioral goals for young children in school and home, it is important to meet with families to get their input. They know their child the best, and it is helpful to hear their concerns and questions. It is also important to be able to provide resources that may assist their child with different therapies, such as behavioral play, occupational, physical, or speech. Holding regularly scheduled meetings with the parents or caregivers is important, because you can decide if the plan that is in place is working, and if it is not, then adjustments can be made. The behavioral data between birth to preschool and kindergarten to grade 3 differs greatly due to the developmental stages and goals of the assessments. In the birth to preschool years, children are developing rapidly in several areas, such as motor, language, and social emotional. The data collection focuses on developmental milestones rather than academic. The settings in which the children are being observed are different as well. In the earlier years, the settings are often play-based at home or in a daycare center. The K-3 observations are typically in a school setting, such as a structured classroom. Collecting behavioral data for children with exceptionalities differs greatly from collecting data on children without. The reasons for this is that children or is that the differences in needs, abilities, and communication styles differ. In some children with exceptionalities, they may not be able to speak to you to answer questions that you are assessing them on. Standard tools may not accurately show the abilities or challenges that the student with exceptionalities is having. In this case, an FBA can be used to monitor. The cognitive levels are different for different levels of exceptionalities. A child that is a certain age may not display the behavioral goals that are standard for their age. In this case, if they have an intellectual disability, they would need to be aligned with an appropriate developmental level.